Right, I think there's a very wide-scale understanding of how vital this institution is for the community. It's a major supplier of healthcare to thousands and thousands of patients every year. Specialty services that aren't available at all, things like kidney transplants, neonatal intensive care units for the very small babies. Right over here we have the medical school, which has 800 medical students. This is where they get their training. And because we're a state school that people can afford to go to, we're a major trainer of African-American physicians, people who are coming from new immigrant families. If you look at our student body, it's like looking at the United Nations. I mean, it's a tremendously diverse, committed group of young people who want to return to their communities and provide service. So losing that would just be a tragedy.
We just want to take this opportunity to welcome you to this momentous occasion whereby we stand in support of the SUNY Downstate Hospital. SUNY Downstate is essentially a blood bank for the community here in Brooklyn. Not only does this hospital offer good healthcare service to us, but this hospital is an economic engine for this community. We are standing on the promise that this hospital will not only remain open, but it will remain a public facility that will serve this community.
Brooklyn does not have its fair share of beds in the city of New York. For far too long, we have disinvested in Downstate and other hospitals in Brooklyn. We need a renewed investment in SUNY Downstate. With its outstanding services and graduate medical education, it offers an opportunity for improved health care. It should be the model throughout Brooklyn. And as opposed to closing it down, you should build it up.
SUNY Downstate Medical Center is a vital institution in this community. We cannot and we will not sit by and allow this institution to be closed or privatized. The governor insists on closing this institution, and we are here today to say we will not allow that to happen. We're going to fast for 48 hours because we are very, very serious. We will not allow them to dismantle this hospital without us making noise, without us taking it to the street. And so we are standing with our workers, we are standing with the union, but more than all, we're standing with the community to say, save Downstate Hospital.
If you knew that more New York City doctors have graduated from Downstate than any other medical school in the United States, if you knew that there were nearly 1,000 medical residents in training providing the kind of service and the safety net that this community desperately needs, if you knew all that, wouldn't you wonder why it took 2 years just to keep Downstate open? The medical school and the hospital together, we need that funding. It will be a win for the doctors, win for the community, win for our kids, and most importantly, it will reclaim the promise of healthcare for this community, which is what the Downstate mission has always been. Thank you very much.
Save Downstate!
Save Downstate! Save Downstate! Save Downstate! Save Downstate! Save Downstate!
Today's event was a kickoff of a 48-hour fast. Our faith leaders of the Downstate Coalition of Faith, Labor, and Community are fasting for the next 48 hours. We believe that Downstate is the crown jewel of Brooklyn. We see over 400,000 patients a year, and this is not the time to talk about closing hospitals. We need to reclaim the promise of health care, and that's what this event was all about.